Hi, I'm Susan Davidson, and I'm going to discuss option 1, what I see as one of the biggest threats for the profession over the next 3 to 5 years. So I consider this to be limited understanding or recognition of the specialised skills of massage therapists and increasing competition. For example, from increasingly sophisticated massage products such as massage chairs, etc., which people can use at home. Also competition from other professions providing massage services such as physios and osteopaths, competition from other products and services, for example, medication or complementary medicines or other therapies. And I think there's also a general perception in the public that massages are nice to have but not essential to health and well-being. This limited understanding and recognition has the potential to increase risk for the profession in upcoming changes under consideration for health professional regulation following the scope of practice review and discussions about self-regulated professions. So how can AMT mitigate these threats? I think building the profession's status through advocacy and policy is actually key. Building recognition and understanding of the expertise and need for the profession using a top-down and a bottom-up approach with MPs, government departments, for example, health, NDIS, etc., and health professionals and the Australian public. For MPs, building understanding of the need for the profession, as this will support policy and program changes at departmental level. For the Department of Health, building understanding to gain support for the integration of the profession in health policy and programs. Allied Health Professions Australia can support this work as they are a key ally and influencer in national health system policy discussions, including potential changes to health professional regulation. For GPs and other health professions, it's about building understanding so they understand the benefits and know when and how to refer their patients to massage therapists. And for the general public, it's about building understanding. This will drive their demand for massage therapy services, also for expansion of private health insurance coverage and inclusion in government programs like the NDIS. This can be done via a grassroots campaign with members' assistance, with members and public stories about their experience with massage therapy on social media, and also providing materials to support advocacy to government and MPs. And these activities can be done at a low cost. And being based in Canberra, of course, I'm able to regularly meet with the Chief Allied Health Officer and other Department of Health officials face-to-face, as well as with MPs during sitting weeks in Parliament House to develop and sustain relationships with government officials and MPs. Communications and resourcing are essential in underpinning this policy and advocacy work. Strong, regular and effective communications can be done cost effectively via electronic and digital comms, including comms to key stakeholders as well as sector partners like Allied Health Professions Australia and peak bodies for relevant health conditions. It is also essential to maintain AMT's focus on building a research database and the academic status of the profession. This builds the status of the broader profession and the evidence base for massage therapy, and it's critical for effective engagement with MPs, government departments and other health professions. And of course, we need the resources to support this work, as it will need to be sustained over the next 5 years and beyond. In particular, there's a need to grow revenue to ensure AMT has adequate resources. There's not time to cover this in detail now, but I have some thoughts on this for a future discussion. One simple to implement suggestion is to increase member benefits and value for money by limiting the resources that non-members can access for free. This is a simple change in pricing policy and website content and would attract more members and member revenue, as well as increase non-member revenue. There's also a need to increase reserves. I note the 2024 annual report has 5 months of operating expenditure held in reserves. I recommend the board consider a reserves policy and plan to increase this over the coming years to the equivalent of 12 months of operating expenditure. I look forward to your thoughts and feedback on my presentation today. Thank you.